Professor Samuel Eyesan. I'm a professor of surgery at YWAW University Teaching Hospital, Ogbomoso. And I'm a surgeon, orthopedic surgeon, and orthopedic oncologist. It's hard to take courage in world. Cancer is the abnormal division of cells forming a mass, and the control of the growth of that cell is lost, so that the cells become autonomous and there's nothing to control the growth, and they become dangerous because they also live on what you eat. And as you eat, what you eat will no longer be enough for the growing autonomous cells. And so that's what cancer is. Well, for this advocacy week or day, we want them to know that it is possible to control cancer, that it doesn't have to kill you if you do certain things right. One is that it's good to know that there are risk factors for cancers that can be managed. And the risk factors are both what we call modified risk factors and the ones that you cannot modify. The non-modifiable risk factors are age. You can't modify your age. You can't modify your genes, the way you were born. But there are some things you can modify. You can modify somebody who is obese. Because we know that somebody who is obese, obesity can cause cancer of all sorts. We know that if you take alcohol, it can cause cancer. So if you can also modify that factor. You can modify the food you eat. So dietary modifications can also occur. And of course, you can modify smoking if you smoke. Those are modifiable risk factors. If you can modify those ones, then you can decrease the risk of having cancer. In fact, that's what the Advocacy Week is for. We preach early detection of the cancer. And the ways for detecting early cancer is that for the person who has the cancer, who has any sign or symptom, to quickly report it. And then when you come to the doctor, you can investigate and find out whether it is true that you have the cancer or not. That is one. And two, after a certain age, there are the procedures, there are things we call screening. So we can also screen you at regular ages to find out whether you have those any cancer or anyone that is developing in the body. Oh yes, like I said yesterday in the program, I have good news for you. And cancer is survivable. I have people in Nigeria who have, for example, prostate cancer, and they have survived for close to 40 years from the day of diagnosis. I have people with breast cancers who have survived 25 years, and I have people who have ovarian cancers who have survived close to 15 years. The important thing is early detection. If cancer is detected early enough, it can be cured.